Extract 1. Questions 1 to 12. You hear a gynecologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat. How have you been doing since our last visit 2 months ago?
Good morning, doctor. I've been alright, mostly. Still feel a bit tired sometimes, but the nausea has thankfully subsided.
Excellent. Now, tell me about any changes in your symptoms since we first met.
The pelvic pain I mentioned earlier persists. It's a lingering discomfort, especially noticeable towards the end of the day, and occasionally, it even extends down my leg.
I see. Did you notice any changes in the frequency or intensity of the pain compared to before?
It feels less sharp than before, but I've been having some mild cramping lately, especially after long days at work. And my periods seem shorter and lighter than usual.
Okay, thanks for letting me know, Mihiraa. Let's talk about your pelvic ultrasound and blood work results. The ultrasound showed no abnormalities, which is good news. However, there is a slight thickening of the endometrial lining, which could be contributing to the pain.
What does that mean?
Sometimes, it can thicken more than usual, which can cause pain during menstruation. Additionally, your blood tests also look normal, except for a slightly elevated FSH level, which is common in perimenopause.
What's the significance of that?
It's a natural transition phase leading up to menopause, where your body begins producing fewer hormones like estrogen. This can cause various symptoms, including the ones you've described, Mihiraa.
So, these cramps and lighter periods are because of hormonal changes.
Yes, Mihiraa, that's likely the case. To manage the cramps, I can prescribe some diclofenac, which you can take when needed. I can also recommend some relaxation techniques like yoga or meditation to help with stress and fatigue.
Doctor, I have a quick question about the medication. Are there any potential side effects I should be aware of?
It's good to be informed. Like any medication, can have side effects. Common ones include stomach upset, heartburn, and dizziness. However, if you experience difficulty breathing, severe allergic reaction, abdominal pain, or black tarry stools, stop taking the medication immediately and seek medical attention.
Alright, I'll keep an eye out for those. Are there any exercises I can do specifically for this pain?
Absolutely. I'll give you a handout with some pelvic floor exercises you can practice daily. These can strengthen your regional muscles and potentially reduce cramping.
How soon can I expect to notice any improvements?
It is individualistic, but typically, with consistent practice, you may start to notice improvements in a few weeks to a couple of months. Remember to perform the exercises correctly and regularly for the best results.
Got it. Thank you for clarifying. I'll make sure to follow your instructions carefully.
You're doing great, Mihiraa. It's essential to take an active role in managing your health. If you have any further questions or concerns, don't hesitate to contact me or the clinic.
I appreciate your support, Dr. Armstrong. Now, what about my next appointment?
Great question. I recommend following up with your GP in 3 months for a general health checkup. I'll also send a referral to a community nurse who specializes in women's health. They can provide further education and support on managing your current symptoms.
Okay, that sounds good.
Take care, Mihiraa, and hopefully, we can meet during the 3rd trimester.
Thank you.
Extract 2. Questions 13 to 24. You hear a neurologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, please come in. So, what brings you in today?
Thank you, doctor. I am Mihiraa. I am concerned about some involuntary movements I have been experiencing lately.
I see. Mihiraa, could you tell me more about these movements yourself?
Sure, doctor. Lately, I've been making these sudden tics, like jerking my head or clearing my throat repeatedly. I can't help it, and it happens randomly. It's embarrassing, especially in public.
Have you tried anything to manage these tics?
I've tried relaxation techniques and deep breathing, but they don't seem to work for long.
Have you noticed any other symptoms, like vocalizations or unwanted sounds?
Yes, sometimes I blurt out random words or phrases. It's completely unintentional and often inappropriate.
I understand, Mihiraa. Has anyone in your family experienced similar symptoms?
Not exactly, but my grandfather did have tremors later in life.
Thanks for that information. Now, Mihiraa, have you had any head injuries or infections recently?
No, not at all.
Are you on any medications currently?
Yes, I take propranolol for anxiety, and I also have depression for which I take fluoxetine.
Okay. Mihiraa, based on your description, there's a possibility you might have Tourette syndrome.
Sorry. But wouldn't that mean?
While the syndrome is associated with motor and vocal tics, the severity and types of symptoms can vary greatly. I would like to run some further tests to confirm the diagnosis.
What kind of tests?
A neurological exam, possibly some imaging studies like an MRI scan, and maybe a session with a psychologist to evaluate your tics and any underlying anxiety or stress.
Okay, I'm willing to do whatever it takes to get a diagnosis and find a solution.
Excellent. If confirmed, there are treatment options available to manage your tics, including behavioral therapy and medication.
What kind of medication?
Mihiraa, we may consider medications like clonidine, but we'll discuss the options in more detail after the diagnosis is confirmed.
That sounds good.
While I can manage the medical side of things, Mihiraa, a psychologist, can provide valuable support through therapy. They can teach you coping mechanisms and help you navigate the emotional aspects of the condition.
That is the end of Part A. Now check your answers.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.